Hello everybody, thank you for joining us today. I'm Dr. Tim Sikosky, and I am the proud co-owner of Valley Foot Care along with Dr. Marissa Haddad. And today we're going to go through some instructional points on how to prepare for an ingrown toenail procedure. To prepare for your visit, we recommend these 4 important tips. 1. Bring a stress ball. 2. Bring a pair of open-toed shoes or sandals to allow room for the bandage. 3. Bring your favorite snack. And 4. Don't forget to wear headphones. Before we get started, it's important to know and understand that a part of the procedure is understanding the 3 basic elements of the nail. When we talk about the nail, there's 3 parts. 1 is the nail bed, 2 is the nail root, and 3 is the nail plate. That is the part that we're most familiar with, and it often becomes curved and ingrown. This nail can be curved as a result of a curved bone that lies underneath the nail, or from a curved root, also known as the matrix, or from genetics. Either way, these 3 elements can give rise to a painful, infected nail and should be treated promptly by your specialist. For the procedure, this is your toe and this is your nail. This is the top view. This here will be the front view. This is if you are looking directly at your toe. So basically a head-on view, and here's the ingrown nail digging into the skin, causing irritation. For the start of the procedure, you can expect a light stick about this area. This is away from the infection to make the injection more comfortable. You should expect a light stick and then a flush of warmth. This flush of warmth that you feel in your toe is an awkward sensation. However, please know that this is the anesthesia and is a necessary part of the procedure, and actually is a good thing. Once your toe is numb, and it will look fairly plump from the anesthesia, the doctor will then gently check the anesthesia in the toe to make sure that your toe is completely numb. The only thing you should feel when your toe is completely numb is pressure and light movement. Now please understand that if we only work on this side of the toe here, that only this side of the toe will be numb, while this other side over here will be awake. Prior to the start of the procedure, your podiatrist will check to make sure that your toe is numb. Once it's been verified that the toe is numb, we will then go down the side of the nail from front to back in this manner, and we will take this whole section here and remove this. This is for a temporary procedure. This is the top view. If we look at that same nail head on in the front view, we would be removing this curved section that digs into the nail. This is for a temporary procedure. Remember, the temporary procedures are done in badly infected nails in which it's important to drain the infection. For permanent nails, also known as matrixectomies, the procedure is identical with the numbing, removing of the nail on the top as well as the front, but in this case we go back here where the root is and we apply a chemical down to the root, and this prevents the nail from growing back again. It's important to know again and emphasize that this procedure with the chemical is only done on non-infected nails. After the procedure, you can expect to have a large bandage. It's important to go home after the procedure and elevate your foot and realize that the anesthesia will only last for 2 to 6 hours. You should take whatever medication your doctor has recommended and prescribed, and this may be something similar to ibuprofen or Tylenol, provided you're not allergic to either one of these medications. It should also be dosed appropriately for your age and other medical conditions that your provider will help assist you with. Once this is done, the bandage has to be removed the following day. The easiest way we have found to remove the bandage is to decide which pathway you're going to take. One pathway is with Epsom salts and water, and the water should be a skin temperature. It does not have to be hot, and the temperature should not be painful when the foot is placed in the Epsom salts and water. The other option is a soakless system that involves a wound gel and a dry bandage on redress. Either way, you can talk to your provider about which one works best for you. In our experience, we have found that soaking the bandage prior to removing it in the foot soaks can be facilitated or sped up by taking a shower just before the foot soak. This way, when we place the foot into the bath for the foot soak, the gauze easily unravels and can be removed and is a more pain-free method. Because this soak is generally done the next day, it's a good idea to take ibuprofen or Tylenol at least 30 minutes before your bandage removal. This makes removing the bandage much more comfortable and much more pleasant. We wish you the absolute best, and we wish you a fast and speedy recovery. And please know that if you suffer from ingrown nails, that our doctors and surgeons here at Valley Foot Care have performed thousands and thousands of these procedures over the nearly 30 years of experience. If you should have any additional questions regarding your care, please consult with your nearest podiatrist or practitioner. Thank you very much for watching, and have a wonderful day.